Hi, my name is Dr. Nick Buhai. I'm an orthopedic surgeon. As you're probably aware, surgery is one of the most meticulous and complicated entities ever known to man. But what you probably don't know is one of the most vital components of surgery: visuals. Now, these visuals can either be from a patient perspective or a surgical perspective. Today in my discussion, we'll be talking about the visuals of orthopedic surgery, more specifically total hip arthroplasty, or better known as total hip replacement surgery. Now, before we dive into our discussion, let's talk a little bit about the history of this hip surgery. In 1923, the first artificial hip socket was installed. Now, the socket was composed mainly of glass and at first succeeded, but eventually it would fail. Though failure was occurrent, it did pave the way for using different materials and different procedure types in the future. In 1962, the size of the femoral component was reduced and replaced with a metal prosthesis. Now you're probably wondering, what is the femoral component? If you take a look at my skeleton here, this right here is your thigh bone, or scientifically known as the femur. Your femoral component is composed of the head of the femur and the neck of the femur, this little area right here. That's what's being replaced with the prosthesis, the metal, and it's being reduced in size. Now, this metal is titanium, by the way. And the hip socket, which is known as the acetabulum, is this concave cavity right here, which the prosthesis would fit into, is being replaced with a plastic cup. Now, if you can envision a titanium ball being fitted into a plastic cup as a single prosthetic unit, this would allow for the head of the femur to move with a full range of motion and a very fluid motion. Now, with this procedure in the 60s, this allowed for an 85% success rate. That would translate to approximately 20 to 25 years of survival rate of the prosthetic component. Now, the 60s procedure paved the way for current materials being used in surgery, such as ceramic and also titanium again, and also the types of tools and the techniques used in the surgical procedure. Now let's talk more about my topic. Follow me to the OR. Welcome to my OR. Now, one may ask, why would I ever need hip replacement surgery? Well, there are two reasons that contain, many subcategories, but we'll be focusing on only a few. The first one would be diseases, now such as osteoarthritis or inflammatory arthritis. Both types of arthritis cause inflammation of either the muscles or the cartilage or the ligaments in the hip socket joint. That would cause, degradation of bone because of the bone-on-bone rubbing, and that in turn would lead to necrosis or death of the bone tissue. The second one would be a traumatic event, such as a fall or hit by a blunt object, etc. That would cause either a fracture or a break in the pelvic region or the femoral region. Now, why are visuals vital for surgeons and patients in the pre-surgical process? Now, for the patient education, they need to be properly informed on what is going to occur to them, and that will in turn relieve their stress and anxiety and better prepare them for the pre-surgical process and the post-operative recovery. Now, for surgeons, they have to ensure that their patients are amply educated. They need to take accurate measurements for prosthetics, determine where they will cut and how much they need to cut or strip, avoid injuring other tissues while cutting, and monitor progress before surgery and after surgery. Now, on the other hand, how can visuals be detrimental? Overreaction. There is a rare occasion in which a patient, upon being informed on what is going to occur to them, will overreact and cause greater stress and anxiety for themselves. Now, this in turn will cause them to seek some other form of treatment or procedure. Next, I'm going to be simulating an entire pre-surgical process that will go to show how vital visuals are in the pre-surgical process. Now, this is going to resemble a normal consultation, which are one of the multiple meetings between the patient and the surgeon before the surgery. Now, if you can envision yourself as a patient who requires this hip replacement surgery, we will discuss why you're here, what is going to occur during the surgery, and what you need to do to prepare before the surgery and after the surgery. Now let's start with the anatomy of the hip joint. As you can see on the poster board here, And surgeons make it a point to have poster boards, they make it a point to have videos, pictures, pamphlets for patients, and x-rays, diagrams, etc. So let's begin. First, we have the anatomy of the hip joint, and we will be discussing the vital components that relate to the surgery. This is your pelvis right here, which is your hip bone. This is the pubic region right here. And we will concentrate more specifically on the acetabulum, which is the hip joint socket. You can see it one more, a little clear right here. That's where we're replacing the first prosthetic part of your hip. Second is your femur, or the thigh bone. And you can see a bigger picture right here, more clear. And more specifically, we will be concentrating on the head of the femur, this portion right here. This is where we'll be cutting the damaged head off, and we'll replace it with a prosthetic component that will go inside of the bone. And then once this is all complete, we'll put the two back together and you'll have a new hip joint. Now you're probably wondering why you're here. Now a normal pelvic hip joint would look something like this. You can see, if you know everything fits good, the bone is very smooth. The hip joint, now you can't see, it's a little clear right here, but it's smooth as well. There's cartilage between the femur head and the acetabulum, which, you know, is lubricates. It's not bone on bone. It's slow, kind of like fluid motion, no problems. Now, on the other hand, why you're here is the arthritic hip joint. As you can see, the bone's very jagged right here. There's minimal cartilage in here, and that jaggedness comes from the bone-on-bone rubbing, which is not good at all. That's due to arthritis. And as you can see, this implant is measured according to the hip socket joint, the acetibular, and it's a cup shape. I actually have one right here. As you can see, it has a very smooth surface. As I stated, it's measured according to the size of your hip socket. You can see inside there it's hollowed out, and a ball joint can fit in there perfectly and have full motion. Now moving to the prosthetic component of the femur. Once the femur head is removed, the bone is hollowed out, so the stem of the prosthetic can fit in, and both this prosthetic and the acetibular are cemented in. The ball will be exposed, and the joint can be put back together. Now, here is the femoral prosthetic. You can see the stem right here. This goes into the bone, right there, and the ball is being exposed. Now, I know they're not compatible sizes, but you can get a vague idea of how this works. You put them together, you see it has very nice motion, full range of motion, very smooth. You know, titanium on titanium works perfectly. Now, the end result of this procedure will be this right here. According to this x-ray, you can see here's a pelvic bone, and there's the acetibular cup. There's a prosthetic. You can see this little cup shape right here. And there's the head of the femur. The joint is put back together. The ball is exposed, and it goes to the femur bone right here. You see it's hollowed out because the prosthetic is inside. Now, next I will discuss step by step the actual procedure we will be doing to you. To not further perplex the patient, the surgeon explains the surgical process in a very simplistic and brief manner. Now, this portion of the discussion typically involves various visuals such as diagrams, models, and x-rays. Now, before surgery, we take an x-ray of the patient, and the joint should look something like this. You see, here's the hip joint, and there's a bone-on-bone rub here and minimal cartilage. This is very arthritic. It is a jagged surface, such as this right here. And the head of the femur looks similar to this. And you see it's dark and black, and that means the bone is atrophied or dead. Onto the actual procedure, you make an anterolateral incision, which is approximately right here, to expose the various muscles and tissues. Now, this cut is usually a foot to 10 inches long. We cut through the muscles and tissues and expose the femur bone. We dislocate the joint, and we cut the head of the femur off at approximately a 45-degree angle. We then take a drill and we strip the damaged surface of the hip socket. This will ensure that a prosthetic can fit in there, in which we do cement in there. Once a prosthetic is cemented into the hip joint, we take another prosthetic and we insert it into the femur once it is hollowed out. We cement that in, and once everything is dry, we reassemble the joint. Now, we check for a full range of motion, and if this is achieved, the end product should look something similar to this right here. You see the entire prosthetic component, or like this right here. You can see the ball is successful. Now, if everything is completed as stated, we suture you up and send you off to recovery. My consultation has now concluded. Now, medical institutions typically offer a pre-surgical class. During this class, patients are given pamphlets, they're preoperative and postoperative pamphlets, that have multiple visual images and text regarding the actual surgical procedure, what they need to do to prepare for surgery, and what they need to do to ensure they have a smooth recovery. Also during these meetings, multiple videos and medical animations are shown regarding the visuals of surgery. This educates the patient on what is going to happen, also with the consultation they will have with the surgeon. Lastly, in these meetings, relatives are given special information regarding to take special care of their relative and ensure they can recover smoothly. Now, what I've simulated in my consultation and what I've spoken on goes to show how vital visuals are in total hip arthroplasty surgery. The surgeons can ensure that their patient is well educated on what is going to occur to them, and the patients can ensure that they educate themselves, first off, and they can relieve their stress and anxiety. I hope you learned something new today, and I sure hope I don't see any of you in my OR anytime soon. Have a good one. Thanks for watching.